Innovation for me means making life better for the patient and hopefully easier for the staff as well. We've introduced a system of labelling for the patient's walking aids, whereby red means that somebody actually has to support the patient while they're walking, yellow means somebody walks beside the patient, and when they are good enough and feel confident enough, they can have a green label on their frame or stick, and then they have the freedom of the ward, and hopefully they can then go home.
Innovation is something everybody can be involved in. UHB Charities provided me with funding for my research in nutrition support. Now my research will help patients meet their nutritional needs and enhance their recovery.
Innovation is about harnessing new technologies to get our message across.
Innovation's about looking at things differently.
We developed a multilingual DVD to go out on the InVision plasma screens right across South Birmingham PCT.
We wanted to produce a step-by-step guide to breast screening in a factual and informative way.
This innovation allows us to deliver our equality and diversity agenda, encouraging many more women to attend for breast screening.
Innovation is using recent advances in drug research and technology to improve healthcare. Here in the eye department, we've developed a fast-track wet age-related macular degeneration service with a groundbreaking new treatment. The benefit to our patients from this new service is that it can help protect sight and can even sometimes improve it.
Innovation is about really listening to what the surgeons need and then responding to those needs. Here at UHB's Tissue Services, we've developed a way to grow the patient's own skin cells and provide the surgeons with spray-on skin to help heal large burns. This means that we are now able to save the lives of patients with extremely large burns, where previously the prognosis was not so certain.
Innovation is about using IT to improve the patient experience.
In UHB IT Services, we've developed a system that allows patients to check in for their outpatient appointments. This means that patients can self-check in for their appointment using the barcode on their letter in a quick and efficient manner.
Innovation is about using IT to improve the patient outcome. In IT Services, we have developed a database to enable the collection and analysis of infection rates of injured military personnel. This allows us to improve treatment to our injured military personnel serving overseas.
Innovation to me is about identifying a need and responding to it. And that need can be close to home, here in the Trust, or can be further afield and can actually represent a global need. We've been able to respond to a global need and that is the lack of renal transplantation in much of the developing world. And we've been able to put together a team to develop transplant programs that can help people who currently have little hope of survival if they have renal failure.
For me, innovation is about developing non-medical skills to contribute to final patient care. I developed a video camera and crane arm system to enable the recording of intricate hand surgery. This enables the Trust to create surgical training videos that contain clear views of surgical procedures that would be extremely difficult to achieve by normal means.
For me, innovation is about looking at things in a new way and improving them. We've implemented a colour-coded tray system to identify patients that need assisted feeding. This allows ward teams to provide assistance with feeding where it's required.
Innovation can be as simple as using patient feedback to improve their experience. In patient affairs, we've used a portable electronic device to help us collect patient feedback.
As a council member, it's made it easier for me to get feedback from patients to help with their experience.
Innovation is the promotion of patient independence. I work with a team of nurses, health professionals, patients and their families to develop products that promote independence after conditions of the heart. Together, we have developed 2 DVDs so that patients can learn skills of Tai Chi and exercise in the home with confidence so they and their carers can move forward towards independence.
Innovation is the collaboration between technical development and clinical engagement.
I'm part of the team that's developed the PICC system for use here in UHB and in the wider NHS.
You're still on the Southampton nebulizer, is that? I think that actually is slightly less reading. The PICC system allows me to take electronic prescribing to the patient's bedside for safer patient care.
Innovation can be about things that you don't normally associate with being in an acute hospital, but can make a real difference to our patients. Our Dignity and Care team have developed an ability, not disability toolkit. This involves all sorts of communication tools that we can use for people perhaps who've got poor vision, poor hearing or unable to speak to us. The hospital communication books helps people with learning disabilities, with dementia or acquired brain injury to express what their needs are while they're in hospital.